Hello, my name is Alicia Bexton, and today I'm going to talk about nurse burnout and how working extended shifts plays a factor in nurse burnout. So, let's get started. So, some statistics out there show nurse burnout can be defined as a widespread phenomenon characterized by a reduction in nurses' energy that manifests in emotional exhaustion, lack of motivation, and feelings of frustration that may lead to reductions in work efficacy. In 2019, the term burnout was added to the World Health Organization's International Classification of Diseases. Around that same very time, there were studies that showed that approximately a third of all nurses in the United States were suffering from this. In 2020, 62% of United States nurses reported having symptoms related to burnout, according to a national survey conducted by the American Nurses Association. So, what are the main factors of this burnout? Is it the COVID-19 pandemic? Is it doing too much? What is it? Well, the COVID-19 pandemic did unleash many challenges and feelings of burnout for United States healthcare workers, and these challenges were made known. Some even say that if changes are not made in the industry, nearly half plan to leave their current positions. So is this it? Was it just the COVID-19 pandemic? Is that the only reason that things are so rough for nurses right now? Quick answer, no. Advances in medicine and patient care have also allowed people to live longer lives, resulting in an aging population and a greater demand on the healthcare system and its workers. So although you have patients living longer lives, you don't have enough nurses. So you've got patients needing more care, but not enough nurses to give that care. So studies have shown that nurses do prefer working the longer 12-hour extended shifts versus the 8-hour shifts that they started years ago. An observational study, though, does show that working 12-hour shifts in comparison to 8-hour shifts in the acute care setting resulted a major impact on nurses' health and well-being, such as cognitive anxiety, musculoskeletal disorders, and sleep disturbances, as well as role stress. And although working extended shifts plays a large role in nurse burnout, nurses and nursing leaders, they don't want to go back to the 5-day work weeks. They do not feel it's sustainable. It is much easier for nursing leaders to find coverage for 3 days a week versus 5. And nurses really enjoy having their 4 days off and being able to get their work done quickly. Some nurses like to work 3 in a row, some like to spread it out, but it's just very flexible for them in their life. So you may be asking yourself, where do nursing leaders start? Well, the big picture here is that we cannot really change from 12 hours to 8 hours. There's just too much pushback at this point between the nurses and the leaders. I mean, nobody's going to want to go from working 3 12s a week to 5 8s a week or 4 10s. Everyone is just kind of set in how they like the routine. It's good for handovers. There's just too many barriers there. So they have to find other solutions to the problem. The first thing that they can do is provide staff members with the Maslow burnout inventory to evaluate how many are truly experiencing burnout. The Maslow burnout inventory is a psychological assessment instrument comprising of 22 symptom items pertaining to occupational burnout. And so what this does is it's just broken off into 3 sections. So you've got A, B, and C. A is going to ask a few questions like if they feel physically or emotionally drained after their day. Do they look forward to going to work? B is going to talk more about the level of acuity of the patients that they take care of and their level of stress. And then C is going to talk more about like the positives parts. Do they have are they full of energy? Do they feel rewarded after their day of work? Do they not feel rewarded? Those types of questions. And then at the end of it, all of those questions are answered and tallied up, and it really helps nursing leaders to evaluate the level of burnout and what is causing, like what area is the biggest. Is it because they're just tired, because they're doing too much? Is it because they're emotionally tired because they're giving too much of their heart? Is it both? Is it just not being able to have that work-life balance that you need? In order to provide good interventions to implement from nursing leaders to nurses, they have to understand what is causing the issues in order to make things better. There may not be an easy fix here, but there has to be a solution to improve things. So doing this is going to really help the nursing leaders compile the responses and to get to the root of the problem. Save our staffing. This is huge. With us having more patients but less nurses, we have to save our nurses that we have. We have to provide a better work environment for them, a more positive work environment. We have to find what fueled their fire. Why did they want to become a nurse? Why did they want to become a healthcare worker? We just have to try to relight that fire and get that going. There's a really nice video here that the Health Institution of Healthcare Improvement created explaining challenges that nursing leaders face. As we all know, nurses are struggling right now. Anytime you turn on a news channel, you hear that nurses are going through a lot and leaving the bedside. But what's happening to leaders? This is also difficult for them. But addressing the problem is the biggest thing. Asking the hard questions that nobody wants to ask. That's huge. Talking about these frustrations with staff is crucial. Finding the root of the cause will help nursing leaders to ensure that they can improve nurse burnout, provide retention of staff, as well as overall mental health and well-being of staff members. So, how can nursing leaders implement interventions for a positive change? So there's different strategies such as training and improving communication skills, yoga and spiritual programs based on meditation, teamwork, computer programs, staff appreciation, and coping strategies can be used to reduce burnout among nurses. So, with that, sometimes it's an education thing where nurses are just feeling like they're doing too much. Maybe there needs to be changes in tasking. Like maybe team nursing can be something where you have an RN, an LPN, and a CNA in charge of the same patients. The RN's doing the teaching and the LPN's doing the tasks. So different things that you can do. Yoga, that's awesome. It helps with relaxation. Maybe employers can give a discount on yoga or they can give a few free sessions, something like that. Training and improving communication skills can be effective interventions to improve burnout nurses. A lot of time, it is hard to communicate, and without the proper training, things can come off the wrong way, and then everybody's just kind of cranky and nothing gets done correctly. The bad part about this, the downside, is that full implementation of these interventions can cost a lot. In providing the necessary conditions, such as commitment is key to the individuals, and preparing participants before the interventions is highly important. So you got to have everyone on the same page. I mean, it's really hard to implement some sort of education if you don't have everyone on the same page. Because if staff, if they're not wanting to do it, they're not going to have that readiness to learn, and it's just not, the outcome won't be effective. So just making sure everyone's on the same page, and leaders can talk to staff about that. They can kind of air out their intervention, like say, hey, this is what I want to try. I want to try giving you guys a new schedule where you have to take a day off in between the first two 12s. You can't work 3 12s in a row. You need to spread out your days and just see what kind of feedback they might get from that. Is there going to be a lot of pushback with that? Because chances are, if there's a lot of pushback, that it's not going to be a very good outcome. I did find this video, Dr. Lizelette Dryby, she's a physician with the Mayo Clinic, and she shares her results of her study appearing in the April 2020 issue of Mayo Clinic Proceedings. And this is directly related to direct supervisors and leadership. And you're going to find that what she finds is actually really helpful because it teaches nursing leaders that they need to be able to communicate with their staff more. and provide better communication. So, what can nursing leaders encourage nurses to do for themselves? So, we cannot put all the blame on nursing leaders. We do have to take accountability for ourselves too as nurses. So we need to develop strong interpersonal relationships. So that means having a good relationship with your physician, having a good relationship with the charge nurse, with your nursing unit manager, with the nurses you work with the CNAs, janitorial staff, the lab, whoever. Just having good, strong interpersonal relationships will really help keep everything smooth. It just really helps with the transition of your patients. It helps with communication. It just helps with the day to go as smooth as possible for the patient and for you. Setting boundaries between work and personal life. This is huge. Being able to say no when you can't. You're working your third 12-hour shift and your supervisor asks if you can work another 12 tomorrow. Well, the money sounds nice, but you're mentally and physically exhausted. If you're that tired now, how are you going to be tomorrow? Are you going to be able to give good care? Are you going to be able to think clearly? So just being able to say no when you know that mentally you just can't do it. And it's okay. Getting enough sleep is huge. So just like we talked before, if you're not sleeping, it could be because you're working too much. And if you're working too much and you're not sleeping, you're not going to think clearly. You're probably not going to give good care. You're probably not going to be a very good team member because you're going to be tired and cranky. So getting sleep is really important. Caring for your personal and physical health. So going to the doctor, getting your screenings, seeing a psychologist if you need to, a therapist, whichever it is. In most hospitals, they do provide some free therapy sessions, which goes on to my next topic here. Seek out regular therapy or assistance programs. It's confidential. Nobody has to know about it. It may help you. It may make you feel better talking to someone else that's not going to be judgmental. They may be able to give you good advice or lead you to the direction that you need. Nurse burnout can truly be detrimental to the care team. This video discusses exactly what nurse burnout is and the impact it has on nurses and ways to avoid it. So this video is from Nurse Mama. She is an RN who is a blogger, and she really breaks down what nurses can do for themselves, because we can't blame everything on leadership. We also have to take accountability for our own actions, and we have to try to improve for ourselves too, because we all have to work in this together. We're all in it together. We all have to work hard together to provide the best care for our patients. Thank you so much for taking the time. I hope that this has made more sense to you now, and understanding why nurses are burnt out and what we can do to help. We may not be able to fix the problem, but what can we do to help? What can we do to improve the situation? Because we need nurses. Patients need us.